You might have seen the story about a Syracuse University student contracting tuberculosis. A similar case was reported in Buffalo last year.
Given the disease's horrific history, this might cause worry or raise questions. Well, Jatira Marsh brought those questions to some local experts, and she joins us now in the studio with what she found out. Jatira.
Adam, Teresa, Paul Levy, who's the medical director at the tuberculosis clinic and a pulmonologist at URMC, says he doesn't see this as a cause for concern. In fact, he says we get a few cases of tuberculosis in our area every year. At URMC in Rochester, we have not had a large volume of cases. He says even nationally, the number of tuberculosis cases has been on a gradual decline.
Nationally, we might have around 9,500, 10,000 cases per year across the entire U.S. In Monroe County, we might have around 20 cases per year in our population of around 1 million people in Monroe County.
Dr. Levy says the disease can be cured as long as the patient has consistent access to the proper medications throughout their treatment. Although you may rarely hear about it, he says tuberculosis testing has never stopped. Instead, it has just become more targeted towards those who are at a higher risk.
The testing is much more targeted around vulnerable populations, people who are underserved or with less access to health care sometimes are at high risk.
He says it can be spread from the respiratory system and the particles that fly out from a cough. There are common signs that you can look out for.
The symptoms of tuberculosis are often cough, feeling under the weather, just fatigue, and it can last over weeks and months.
Dr. Levy says typically when someone is detected with TB, health professionals try to find out who that person has been in close contact with in recent weeks and months to track exposure and prevent secondary cases from happening. Teresa, Adam, back to you.
Jatira, thank you for that report. We do have more information about all this right now on our website. That's rochesterfirst.com.